Your bedroom could be the most dangerous place for your heart right now. There are 5 things happening between dusk and dawn that are silently threatening your life, and you're probably doing at least 2 of them tonight. What I'm about to reveal might shock you, but it could also save you. Welcome to my YouTube channel. I'm Dr. Robert. Today, we are talking about something that doesn't get nearly enough attention. What happens to your cardiovascular system while you are asleep? Most people think bedtime equals safety, but for many adults over 50, the opposite is true. The wake-up call nobody sees coming. Let me tell you about something that changed how I practice medicine. I once treated a gentleman in his mid-60s who seemed perfectly healthy. He walked every morning, ate reasonably well, and his medical numbers were only slightly elevated. During one appointment, I asked about his sleep quality. His response? "It's not perfect, but what do you expect at my age?" 3 weeks later, he passed away in his sleep. No dramatic symptoms, no midnight emergency, just gone. His family kept saying the same thing. He mentioned feeling tired, but we thought that was normal. Here's what most people don't understand. Nighttime is not when your heart is safest. For millions of people, especially those past middle age, the hours between bedtime and sunrise are actually the most vulnerable. Why? Because your body undergoes massive physiological changes during sleep. Your blood pressure fluctuates, your breathing rhythm shifts, your oxygen levels can drop, and certain everyday habits that seem harmless during the day become potentially lethal at night. Let me walk you through the 5 critical mistakes, starting with one that almost everyone makes. Mistake number 1, the water paradox. Here is something that sounds completely reasonable. Stop drinking fluids after PM so you don't wake up needing the bathroom. Logical, right? Practical, even. But here's what's actually happening inside your body. When you deliberately dehydrate yourself before sleep, your blood literally becomes thicker and more viscous. This makes your heart work significantly harder to pump blood throughout your system. Now combine that with what naturally happens during sleep. Your heart rate decreases and your circulation slows down. Thicker blood plus slower circulation equals a perfect recipe for clots, blockages, and cardiac events. There's a reason why heart attacks and strokes peak between 2 and a.m. It's not random, it's biochemistry. The fix is simple: a half cup of water about an hour before bed. That's it. Not a full glass that disrupts your sleep, just enough to keep your blood flowing smoothly during those critical pre-dawn hours. Mistake number 2, the position problem. Think about how you sleep. Are you lying completely horizontal? For decades, that might have been fine. But as our cardiovascular system ages, lying flat creates a hidden problem. Fluid shifts toward your chest cavity, increasing pressure on your lungs and forcing your heart to work harder. Have you ever suddenly woken up feeling like you couldn't breathe deeply? Or found yourself needing to sit up to feel comfortable? That's not a nightmare or anxiety. That's your heart sending an SOS signal. I remember a patient who slept propped up on 3 pillows. When I asked why, she shrugged and said it just felt better. Her body had figured out what her mind hadn't. Elevation reduces cardiac strain. You don't need to sleep sitting upright like you're on an airplane. A gentle incline of just a few inches can dramatically reduce the workload on your heart during those vulnerable nighttime hours. Mistake number 3, the medication trap. Sleep aids are everywhere: over-the-counter pills, prescription medications, natural supplements, nighttime pain relievers, and most people think they're harmless. But here's the dangerous truth. Many of these substances can suppress your breathing, lower your oxygen saturation, or disrupt your heart's electrical rhythm, especially in older adults. The scariest part? These effects happen silently. You don't feel pain, you don't wake up gasping. Your body simply slips into a dangerous state while you're unconscious. I've reviewed too many cases where someone died peacefully in their sleep, and when we investigated deeper, a bedtime medication was involved. Before you take anything to help you sleep, ask one specific question: is this safe for my heart overnight? If your doctor can't give you a clear, confident answer, that's a warning sign. Mistake number 4, the normalization of warning signs. Humans are masters at adapting to discomfort. We tell ourselves stories. Snoring is just what happens when you get older. Everyone feels tired in the morning. Night sweats are normal, but your heart doesn't adapt. It tolerates stress until suddenly, it can't anymore. Loud snoring, breathing pauses during sleep, waking with your heart racing, persistent morning headaches. These aren't just annoying sleep problems. They're red flags signaling cardiovascular distress. Sleep apnea, for instance, causes repeated oxygen drops throughout the night. Your heart is forced to work under low oxygen conditions for hours, dramatically increasing your risk of heart attack, stroke, and sudden death. The tragedy is that the person suffering often has no idea, they're unconscious, only a bed partner notices the gasping and breathing interruptions. I once asked a patient why he never mentioned his severe snoring. He laughed and said his wife complained constantly, but he figured it was harmless noise. It wasn't. After proper treatment, his dangerous heart rhythm disturbances completely resolved. Don't dismiss symptoms just because you've gotten used to them. Adaptation isn't the same as being safe. Mistake number 5, taking your stress to bed. This is the big one, the mistake that amplifies everything else. Most people think stress is a daytime problem, but how you enter sleep determines how your heart behaves for the next 8 hours. If you go to bed mentally wired, anxious, angry, or scrolling through disturbing news, your nervous system doesn't shut down just because your eyes close. Stress hormones remain elevated, your heart rate stays high, your blood pressure doesn't dip the way it should. Your heart is designed to recover at night. That's when cellular repair happens. But it can't do that if your mind is racing and your body is flooded with cortisol and adrenaline. I've seen patients with normal daytime test results but dangerous nighttime heart rhythms, the common denominator. Unresolved stress carried into sleep. One patient described it perfectly. Nighttime is when my brain gets loudest. That was exactly when her heart was under maximum strain. The solution doesn't require medication or expensive equipment. It requires a deliberate wind-down routine, 20 minutes of quiet transition between your day and your sleep. No arguments, no alarming content, no bright screens stimulating your nervous system. Instead, dim lights, slow breathing, gentle stretching. When your breathing slows, your heart follows. That's not feel-good advice, that's how the autonomic nervous system works. Think of it as giving your heart permission to rest. Bringing it all together, here's what makes these 5 mistakes so deadly. Individually, they seem insignificant. None of them feel like emergencies. They feel like habits. But when you combine them, dehydration, poor positioning, risky medications, ignored symptoms, and elevated stress, you create a compounding effect that eventually overwhelms the heart's resilience. The people who experience sudden cardiac events during sleep aren't reckless. They're simply unaware of what nighttime conditions do to cardiovascular function. Practical action steps. So tonight before bed, do these 5 things. 1. Drink a small glass of water an hour before sleep. 2. Elevate your upper body slightly, especially if you've ever felt breathless at night. 3. Question any sleep aid you're using and verify it's heart safe. 4. Pay attention to symptoms you've been dismissing as normal aging. 5. Create a calm, quiet transition into sleep. Let your nervous system downshift. These aren't extreme interventions, they're intelligent corrections based on how your body actually functions after dark. Here's what I want you to remember. When something goes wrong during sleep, there's no second chance, no warning alarm, no opportunity to call for help. But the reverse is also true. When you protect your heart properly at night, everything improves. Your blood pressure stabilizes, your energy increases, your mental clarity sharpens. Nighttime care isn't separate from heart health, it's the foundation. So here's my question. Which of these 5 mistakes have you been making without realizing it? Think about that honestly. If this video opened your eyes to something you've been overlooking, do 2 things. First, click that subscribe button and turn on notifications so you never miss life-saving health information. Second, watch my next video where I reveal the 3 morning habits that quietly damage your heart before you even finish breakfast. Your heart doesn't get a break just because the sun comes up. Stay informed, stay protected, and I'll see you in the next video.